And now, ladies and gentlemen, please help me welcome Dr. Joseph Coughlin to the podium. Professor Coughlin oversees the AgeLab at MIT, and for those of you who received the most current issue of Money Magazine this weekend, as I did, you would have read the featured article about him. So, Dr. Coughlin.
Thank you, John. Good morning. Well, come on, your sugar rush from the morning and caffeine should be kicking in. Good morning. Good. Susanna's presentation is always very good, and we did not coordinate our content, but I think hopefully there will be some overlap for good thinking and discussion later on. I want to thank Joe Trinillo, Joe Kvedar, and all the Connected Health community for having me here this morning. So let's cover a little bit of ground, or actually a lot of ground in a little bit of time, and see if the slides come up, and talk about, frankly, from the consumer's perspective, particularly the older consumer's perspective, the feature of connected health, and to have you think about, shall we say, some business activities and issues that many of us may not be thinking about because the availability of the technology may not necessarily be getting the take-up and adoption rate that we would hope, given the great opportunity we have and the health needs around it. So I like to use this slide because I don't like to be the only person with the same haircut, but I see a number of you go to the same barber shop I do, so I don't have to worry about that. So technology and aging should go right together. We've got this incredible disruptive demographic of people aging very quickly in the United States and indeed around the world, and we've got this whole bucket of new technology looking for a problem because it can be the solution. What would happen if we put those together? Should be great things, if it should only be that simple. So let me give you a few, shall we say, visions or hallucinations, depending on your level of kindness, of what that future might look like or what the problems might be ahead. Because I want you to think about something. Every new solution generally creates at least one or two new challenges. Like the technology I have in my hand. So let's talk about the bucket, shall we say, that are out there. I mean, all of us, and many of you are vendors, developers, researchers in the area, but start thinking about what does this connected health look like. I'm going to pick some extreme, but I think fun examples. We have clothing that will track you if you're wandering. We can track you within a few meters of accuracy anywhere on the planet. We can talk offline as to whether you want me to. Yes, your underwear now has sensors that will be talking to your refrigerator, which may be talking to a grocery store. Before we had friends, we used to have friends, now we have social friends and lots of them online. And in fact, we even have toilets that are now talking to grocery stores, facilitating home delivery, and since we're very close to lunch, I'll keep this clean, that your toilet has downloaded from you that believes that you actually need as part of your diet. And in fact, we even have silverware, our mock silverware, that will measure the viscosity, the sugar level, and the cholesterol in that brownie mix you're making, uploading it to either your dietitian, your call center for your doctor, or worse yet, in my case, my wife. In my lab, in fact, we even have cars out on the road that are monitoring and managing your health behind the wheel to be able to ensure your driving ability as you're going down the road. So there's a lot of connected health opportunity. But the trouble is, the first people we tend to think about were where the consumer electronics industry and the software industry and the various other industries that have discovered health and an aging population tends to have this face of the consumer in the back of their mind quite often. They're the lead adopters. They want to do it for fun. They've got a lot of time to buy the next best thing, that high style and high fashion, when in fact, we're probably selling it actually to these folks. Now, this is class participation is 10% of your grade today. All of you born between 1946 and 64, please raise your hands. Keep them up. I want you to note that the older folks would wish you'd just be quiet and the younger people would wish you'd just go away. You are the baby boomers. And one of us is turning 66 roughly every 7 seconds. And in the words of Jimmy Buffett, we are the people your parents warned you about. So here's the question. Are they going to expect old age the way that their parents did, very quietly and being very well managed and having authority figures, if you will, tell them what they need to do 24/7? Or are they going to expect something different? And I think the difference that we're talking about is looking for technology that works here. We'll do it the old-fashioned way. How's that? The baby boomers certainly have had enough technology in their lifetimes to actually expect that it's going to work. In fact, even the older population, well over 90%, do believe that technology can make their lives much better, if you will, than it has in the past, and will continue to do so. So they have confidence that there's going to be an app for that, whatever it might be. And that's probably the biggest difference in the next generation of old compared to the past. But let me give you 5 different challenges, not necessarily problems, but challenges ahead that we need to think about if we are going to realize the true benefits of the new technology with an aging population. And I would suggest to you that despite the great promise of technologies that have been around, frankly, for decades that offer great promise, the take-up rate has not nearly been as good because we've been focused so much on the technology that we forget some very real issues around consumer and consumer engagement. So let's talk about the first one, distribution, consumer engagement. How do we actually get people to be interested in the new connected health technologies out there? Is it the classic, help, I've fallen, I can't get up? Because if you think about it, healthcare is still stuck in this bucket of, if I give you enough facts and if I give you enough fear, you're going to be motivated. How many of you go to a shopping mall at least once a month? Do you guys notice that they use facts and fear a lot there to spend obscene amounts of money on things you really don't need? We're asking ourselves about why can't we get people engaged? Maybe we just give them more facts. Maybe we'll give them a little bit more fear. In fact, it doesn't work. You spend more money on jeans you don't need because of fun, fashion, and frankly, friends. You know, as the philosopher Yogi Berra said, you can see a lot by looking. If we want to understand how to engage, particularly the baby boomer consumer and their kids, we have to start thinking about how is engagement being done successfully elsewhere. Now a trite example, but I'll use Apple. Apple has made engagement fun because they engage, they educate, and they don't make it necessarily so much work to do so. And by the way, if you ever want to watch Apple in action with an aging population, show up a half hour before they open, and you'll see a very, very long line of older adults out there learning new technology. In fact, the average age of the iPad buyer is well into their 50s, and that's an average. By the way, that photo you see up there that looks like a cafe, it's not a cafe. What's more boring than healthcare? Finance. It's dearth of finance and facts and fear, all kinds of things for your retirement. The new successful financial services model is, guess what? We're building cafes. So State Farm, ING, and the like are starting to make it so that pick up a cup of Pete's coffee, have some fun, talk to some friends, and oh, by the way, let's talk about insurance and retirement. We have to add a little bit of sugar, even though my family has a long line of type 2 diabetics, add a little bit of sugar, if you will, with discussions that frankly people either don't want to have or may not even have time to talk about. Second, no, I'm very fond of what Clay Christensen and Theodore Levitt at the art school up the river from us, Harvard, described as understanding what the jobs of the consumer are. And so here's a question I have for you. By asking for people to collect more data, to use their smartphone, to use an app, to go to a social website, to use a widget to see whether mom is safe or not, are you making it easier or are you adding more jobs? So just think about the idea of purchasing decision of an integration tool to put into your house or your mom's house to remind you to take your meds and make sure she's okay. You've got to select it. So how do you do that? You have to pay for it somehow, whether it's a reimbursement or not. Installation, you have to learn how to use it. Then you have to use it. By the way, over time, maybe there'll even be trusted adoption. Then there might be service. Replace, and by the way, repeat it all over again. So that profoundly rational technology that you think you're giving may in fact be giving new jobs. And so I would like to point to other examples where that other companies have started to say, wait a minute, we realize that if we can reduce some of that friction, we can move more product, more service, and have better outcomes. So Staples, the classic easy button. Geek Squad at Best Buy. This is that service layer that they overlay on top of the product that they sell in the store and the experience they sell in the store to actually reduce that friction with the customer in such a way where you're not selling a commodity, you're not necessarily selling a service, you're trying to move a solution that hopefully, in our case, in health, results in better outcomes. Data fusion, or are we just giving more confusion? I was very intrigued with the discussion we've had this morning in general in terms of big data and how people are tracking themselves. I have a couple questions. All the new data that we are collecting, are we creating new jobs for both the well and the ill? And by the way, those new jobs, you have to compete, if you will, with all the other things I have to do in my daily life, including going to work, planning for my retirement, taking care of my family, getting a kid to soccer. In other words, the tyranny of the daily trade-offs of everyday life is not necessarily looking for more data. That mindfulness that we are assuming as rational players in healthcare is not taking into account the context, I would argue, of what other people are doing in their daily lives. So if you want to understand the future of aging and who actually controls the healthcare of an older adult, go out and ask yourself, ask a 47 to 57-year-old oldest adult daughter. 1 in 4 American families today provide 21 hours per week of care to an older adult. Now I want to ask you, in between her job, her parents, probably his parents too, her kids, and a husband who can't make a peanut butter and jelly sandwich, do you really think that she needs more data, or do we have to be very careful to make sure that as we produce ideas, we provide solutions, if you will? And so health alone is certainly a very important topic, but in the daily business of life, so is everything else. How many of you are willing to trust your mother to the cloud? That's what we're asking. I mean, connected health, in many ways, is trusting your mother, your father, and eventually you and your kids to the cloud. And I think there's some legitimate things to talk about there. And in fact, we can trust our parents to the cloud, but we have to start thinking about some issues that I'm not sure we're quite prepared for yet. One, are we ready, and do we believe today that we have a higher state of system reliability? We're no longer talking about, oh God, I lost my Christmas list or that document I needed for work in the cloud. Now you've got to make sure that that system reminds your mom on the right time to take that right med, to make sure that that wandering monitoring system is indeed working and it has 24/7 seamless connectivity. And I can assure you that technology is 99.9% accurate. But there's that point something that we need to think about. Anyone ever hear of sudden acceleration in a variety of things in cars that are increasingly automated? So we have to start thinking about what's going to happen with the technologies that we are increasingly taking a frail population and making them the first adopters and lead users, if you will, of a system that the rest of us who are in better shape haven't tried yet. Second is, we see this in transportation, safety homeostasis. Fancy jargon for, gee, now that I've got other folks watching my parents or watching the frail people in my life, does that change how interactive I am? We would hope that it would make you more engaged, but I think there's a chance that as we start to outsource things more to technology, we may step back. And we all know that the key to good healthcare still today in the United States is a very strong patient advocate, which is usually a family member. And then on a legal note, to cross into public policy, and this is more for Joe Tonillo to think about as an attorney, is that, in the litigation world, we often think of the reasonable man standard of how we design everything from sidewalks to cars to maybe even healthcare systems. Now that increasingly the systems that we are developing, the services we are providing, are going to be provided not to a reasonable, quite often young man, but to a reasonable older woman, is there a new standard of liability and a new standard of performance that we are going to need? And by the way, this isn't just some conjecture. We've seen this happen before. Good technology not integrated well into how operations are supposed to be done, how systems are supposed to be responded to, has resulted in bad outcomes overall. And then finally, new technology demands new workforce. Either new training, if you think we can squeeze one more course into a 4-year medical program, or one more course into a nursing program, or all the social workers and all the other gerontologists and the like that are in the business of caring for an aging population. Think about the dominant model that we are coming out with health reform. We've got this great idea. We call it the medical home. We're resurrecting Marcus Welby, MD. Well, I've got to tell you, Marcus is dead, and I'm not sure, for those of you who are physicians, are you ready to take in that much more input to be able to make the decisions and to engage with your patients the way you think? And by the way, with the average doctor being 53 and not many people coming into the general practice after them, I'm not entirely sure that additional burden is going to be welcome. And with the average nurse being 48 with a shortage out there to begin with for the caring of a population, I do think that we need to rethink of, is it the medical home, or do we need a new generation of professionals that will distill these data into meaningful knowledge, both for the physician, patient, and increasingly the caregiver? The call center of the future. If you think about it, the call center we currently have is the same call center we use when the alarm goes off when there's a fire bell in your house. Is that the same call center and the same kind of training, same kind of response that we are going to be able to use for an aging population? What are those new professions going to look like in the call center, or coaches, or how do we turn data into knowledge and then into action? I'm not entirely sure. But one thing is sure, Connected Health is going to produce an incredible amount of data that we've never thought about before. The next generation of tools and apps and systems is going to have to concentrate as much on visualization and distillation of what it means and how to get it to me in such a way that I can act on it in limited time and also be able to see on my BlackBerry without my glasses so that I can actually do something with it. So lastly on that point, I want to quote something that Joe Kvedar said a number of years ago that still sticks in my head. Until we can call telemedicine and like systems, I'm paraphrasing Joe, medicine, we will not have made it yet. And right now we're calling it connected health. In some areas we call it telemedicine, telecare, we call it apps and the like. Until we can make the science and the technology and the systems we are talking about at this fine symposium into the new normal and not the new innovation, and get it into the professional socialization of our next generation of caregivers, I think we're going to have a challenge, a great challenge ahead of us. So on that note, according to my twin brother up there, if one of us is turning 66 every 7 seconds, roughly 200 of us just turned 66. Thank you very much. Thanks.